Hi, I'm Dr. Rob Cushman, the Acting Medical Officer of Health for the Renfrew County and District Health Unit. Today I've got great news, but I've also got some work for you. Basically homework before schools go back after Labor Day. Now schools go back 5 weeks from yesterday, so there isn't much time left. The good news is the province released their plan yesterday, and it's a very good plan in terms of how we can get the kids back to school so that they can make up for all they've missed, get back to see their friends, get their education going on a much better footing again. And we can do this. We saw this in the schools in Renfrew County last fall and winter. It was a source of very little infection, very little. And the schools are excellent at maintaining a very safe venue, and they can do it, I'm convinced. Now, granted, we may have big problems with wave 3, but we can turn this thing on a dime. As it looks today, we can do this. But on the other hand, we have some homework to do. We are now standing where 17,000 people in Renfrew County and District have not been vaccinated. And when you put that together with the young ones, some 11 or 12,000, we have almost 30,000 people that have not been vaccinated. That's a big pool for any COVID virus, and more so for a variant like the Delta. So we have some work to do. So the homework before you head back to school is this. We've seen that almost 70% of the teenagers, the 12 to 18 group have been vaccinated. We need to get that number higher, as close to 90, 95% as we can, maybe even 100%. Probably not, but close. And also we need to get the second shots going. And we need to get the parents vaccinated. Parents of those children in high school, the ones that are eligible for vaccines, but also the parents of younger kids who have not been vaccinated and probably will not be vaccinated well into the new year. Equally, staff and teachers need to get vaccinated. This is the only way we're going to protect the children, and we're going to keep the schools working as best as we possibly can. We've seen it. The kids will bring an infection into school from their parents, or they'll get it in the school from children of other parents or from staff. That's what happened last fall, and that's how it spreads. So the more vaccines, the better. This is the homework that needs to be done between now and the day after Labor Day. So please, it's a plea. If you want to keep our schools safe, if you want education to return to as near normal as possible, it's the vaccination rates that count the most. The schools can do the distancing, they can do the masking, they can supervise the kids, they can keep a safe environment, and we at Public Health can monitor the odd case, we can help the schools, and we can turn on a dime if something really untoward happens with the Delta variant. But in the meantime, the best course of action is to roll up your sleeve and get your first or your second jab as soon as possible before school starts. Thank you very much.